Hello and welcome to Talking Pharmaceuticals, an interview series brought to you by Making Pharmaceuticals and Distributing Pharmaceuticals. I'm Victoria Emerton, Conference Director for the events which next take place in April 2025. And in the lead up, I'll be joined by experts from UK Pharma to share insights, opinions and practical advice, providing a fresh perspective on key challenges and opportunities in the industry and to look ahead to their involvement in the events. I'm delighted to be joined today by Vicki Pike, Operations Manager and Senior Consultant at EPiC. Vicki, hello, thank you very much for joining me at Talking Pharmaceuticals.
Pleasure to be here, thank you.
So you've not been to the event before yourself. I know EPiC have been, and it's great to have them involved in the event again, but you've not been yourself. So could you tell us a little bit more about yourself?
Yes, of course. So I'm a pharmacist by training, but I've spent over 25 years working in the pharmaceutical industry. I'm an eligible QP, and I spent 7 years working for the MHRA as a GMDP inspector. So I joined EPiC in November last year. We provide consultancy services to the pharmaceutical industry, including performing audits, mock inspections, and delivering training, among other activities. So this will be my first time at Making and Distributing Pharmaceuticals. Looking forward to attending. The programme is quite impressive.
Thank you very much. So you're giving a presentation, Auditing Effective Self-Inspections. So what are the key benefits of conducting effective self-inspections within an organisation?
So self-inspection is a regulatory requirement, both in the GMP and the GDP regulations. So any company that manufactures and distributes pharmaceuticals, they must have a self-inspection programme in place. But there's more benefits than just doing it because you have to. So self-inspection should be seen as proactive quality assurance. So you're independently reviewing your systems and processes to ensure that they're compliant and operating effectively. So you're taking ownership for identifying gaps and correcting them, because the worst case scenario is that a deficiency isn't identified and corrected, and defective products could end up being supplied or distributed to the market and cause patient harm. So we all want to prevent that. So self-inspection also gives senior management insights into the performance and the compliance of their departments, ensuring overall business efficiency and regulatory compliance.
So what are some of the common gaps between self-inspection findings and regulatory findings, and how can organisations address these gaps so that they're fully compliant all the time?
Yeah, so in EPiC, we've seen several companies where the MHRA have escalated to their inspection action group because they've identified critical deficiencies or large numbers of major deficiencies during a GMP or GDP inspection. And when we look at these companies' self-inspection reports, they often only identify minor or sometimes no findings. So that's a huge disconnect. So I have some theories why this occurs. So this can include that the auditors performing the self-inspection are not properly trained, that there's inadequate time allocated for self-inspection, that it's not taken seriously by senior management, and this attitude cascades down through the organisations. So in essence, they're just ticking the box.
Yeah, I mean, the whole point of doing it is to identify issues before you have a real inspection and you've knocked those problems on the head. So you're delivering the best possible service. So they need to be done properly, or there's no point doing them at all, I guess. So can you share some practical tips for preparing and conducting a successful self-inspection audit? What should people be doing?
Yeah, absolutely. So I can't emphasize enough the importance of the preparation phase. So I always feel much more comfortable and confident when I know I've done decent preparation. So some of the things I do, I would be looking at lists of recent deviations, complaints and changes associated with the self-inspection topic, because these can be useful indicators of potential risks in that area. Then, as well as creating an audit plan or an agenda for the auditee, I create an aid memoir for myself to remind me of the specific requirements that I want to check, and any risks that I've identified during the preparation which I want to follow up on. When I'm performing the audit, so I'm assessing, are the right controls in place? Are they being followed? Are they operating effectively? And I try to spend a minimum of 25% of my time in the area being audited, such as the warehouse, the production or packaging areas, and the laboratories. That I spend time observing the activities being performed and speaking to the people that actually do the work. But ultimately, we only get the value from self-inspection when the deficiencies have been addressed. So best practice would be to perform a root cause analysis to understand why the deficiencies have occurred. And then, as well as correcting the gaps that have been identified, organisations should consider implementing preventative actions in other departments to make sure that the same issue doesn't occur there.
Yeah, absolutely. A problem in one area might well be happening somewhere else. And these processes aren't sort of static. You can't, I guess, think, well, I've done that, that's fine. You need to work on continuously improving, don't you? So how can organisations ensure that their self-inspection programmes are continuously improving and remain effective over time?
Yep, so I would recommend that a company does an annual review of their self-inspection process to confirm that it's operating effectively. So you should be looking at your KPIs from across the year. So, were audits performed on time, CAPAs agreed on time, reports issued on time. I would then trend the deficiencies by their criticality and by their topic, and this can be useful to indicate if a targeted improvement project is required in a particular area. I would look to check, do I have sufficient trained auditors to meet the needs of the programme? And then ask for feedback, both from the auditors and the auditees, to identify any improvement opportunities that they can think of.
Well, quite people, who are literally hands-on will have suggestions, and their input is hugely valuable. And having all those processes in place must be hugely reassuring, to know that on a daily, ongoing basis, everything is running as it should. And obviously, you guys can help with that. So, can you give me some background on EPiC and how you can help companies ensure that self-inspections that they're doing are adding value?
Yeah, so we're a consortium of pharmaceutical consultants, most of whom are ex-MHRA inspectors from across the different GXP sectors. And we can offer global GXP consultancy services to the pharmaceutical industry. So in relation to self-inspection, so we could perform a critical evaluation of your company's self-inspection system, or we could supplement your programme by conducting ad hoc audits. And we've also delivered in-house training and assessment of a company's self-inspection auditors. So as former inspectors, we are experts in this area, and we're ideally placed to train, to coach and mentor internal auditors so that they are able to conduct effective self-inspections.
Brilliant. So EPiC will be exhibiting at Making Pharmaceuticals on stand 314, and you, Vicki, are giving a presentation, Auditing Effective Self-Inspections. So lots more pearls of wisdom to come at the event through your presentation. And I'm sure EPiC are bringing a team to man the stand. I know your colleague Lewis Corbett is also presenting at the event. So while you guys are off presenting, there'll be people on the stand for anyone coming to visit to come and talk to pick your brains.
Yep, absolutely happy for people to pop in past and say hello.
Fantastic. So just to remind everybody watching that attending the exhibition and the conference is free, and registration is open at www.makingpharma.com. The conference programme is also live on the website. It's 8 sessions running in parallel across 2 days, including some workshops, panel discussions and keynote presentations. So well worth spending a bit of time to have a look at that and plan how to best use your time both in the conference and the exhibition. And we look forward to seeing you, Vicki, and your colleagues at Making and Distributing Pharmaceuticals at the Coventry Building Society Arena on the 29th and 30th of April. Thank you very much for your time today.
Thank you. See you then.